A bladder diary is a record of your fluid intake as well as urine output over 3 consecutive days. This requires the record and measurement of fluid intake, which includes water, juice, coffee, tea, or anything that you have drunk, and any urine output throughout the day, be it in the morning or at night time. This is a very important objective gauge of how much water you are drinking and how much urine you are passing out, especially in patients with suspected overactive bladder or sensitive bladder, or for patients who feel that they are going to the toilet too frequently, either in the daytime or at night time. This is meant for patients who have symptoms of frequency, where they feel that they are going to the toilet frequently, when they have feelings of urgency, the sensation that they are unable to hold urine and need to go to the bathroom immediately, or for people who have nocturia, where they have to wake up at night to pass urine. So a bladder diary helps to distinguish if you have a sensitive bladder or an overactive bladder, if you're drinking too much fluids, or if you're just producing too much urine at night. First, choose 3 consecutive days that you will be at home so that you can monitor and write down the amount of fluid you are taking and the amount of urine that you are passing out. Next, use a measuring cylinder to measure your usual cup at home so that you can write down how much fluid you are taking each time. Also use a measuring cylinder to measure the amount of urine that you are passing out each time and record it down. In the bladder diary, it is important to write down the amount of urine that you are passing out and at what time, as well as the amount of fluid you are taking and at what time. In between these episodes, if you have any sensation that you feel very urgent, you need to go to the toilet immediately, or any leakages of urine, you should write that down as well. When you get a bladder diary, it will come with this instruction sheet as well, where you would essentially need an extra plastic measuring jug that measures in mils. Ensure that the container can contain at least 500 mils in the case that you pass out a large amount of urine. So before you use it to measure urine, you use it to measure your usual drinking cup or your bowl where you used to contain soup. So note down the volume that it can contain, and subsequently when you drink from the cup or the bowl, you will have known how much fluid you are drinking. So for every time you are passing urine, you will have to pass into the measuring cylinder and note down how much urine is passed. So this is a bladder diary where there are 3 columns for day 1, 2, and 3. So choose any 3 consecutive days that will be easy for you to measure the amount of fluid you are taking and the amount of urine that you are passing out. So starting from the first day, if you are waking up at 9 o'clock and you drink 200 mils of water, you will record it down as such. 9 a.m., 200 mils of water. For example, if at 10 a.m. on the same day you need to pass urine, you will pass your urine into the measuring cylinder and record down the amount of urine that you have passed out. Okay, so 10 a.m. you pass out 300 mils of urine. If at 12 noon you are having lunch and you drink more water, you will be taking 500 mils as measured. And supposing after lunch, if you feel that it's very urgent and you actually do leak out some urine, okay, and it's very urgent, you write down at what time you feel it. For example, if at 1 o'clock you feel that it is urgent, you will write U, okay, U for urgency. If it's so urgent that you actually leak out, okay, you have to write W for wetting yourself. And at that point in time, if you have passed out urine just slightly after that at 1:50 p.m., you will write down how much you have passed urine, for example, another 200 mils. Okay, and this goes on until at night. Supposing at night you are sleeping at 10 o'clock, okay, so you write down 10 o'clock, you have slept, but before that you decide to drink a glass of water, another 200 mils. So you write down here, this is your sleeping. If you are waking up at midnight to pass urine after you have slept, you will need to record down as well here, for example, another 150 mils of urine passed. If throughout the night you are still waking at night to pass urine, You will record the times accordingly as to how much urine you are passing. For example, another 200 mils at 2 a.m., supposing at 4 a.m., another 300 mils. So this will continue until the next day, and you will continue so on and so forth.